Hi everyone, Dr. Tank here. UTIs or urinary tract infections are often misunderstood. Today we'll dive into what they are, how they're diagnosed, and how they're treated. By the end of this video, you'll have a clear idea of what UTIs are and how to treat them if you suspect you have one. Let's get into it. A urinary tract infection is an infection of the urinary tract. This can include the urethra, the bladder, the ureters, or the kidneys. Depending on where the infection is, we usually give it a different name. Cystitis is commonly referred to bladder infections. Kidney infections are commonly referred to as pyelonephritis. Infections in the urethra sometimes are called urethritis. Common symptoms of UTIs include a strong urge to urinate, a foul-smelling or cloudy-colored urine, urinating more than normal or increased frequency, a burning sensation when urinating, and passing frequent small amounts of urine. It can also include lower abdominal pain, low back pain, or upper back pain. If you start to develop more serious symptoms such as fevers and chills, nausea or vomiting, this may be a sign of a more advanced infection which could lead to sepsis. But we'll get into that later on in the video. UTIs are usually caused by bacteria that enter the urethra and multiply in the bladder. Risk factors for UTIs include being a female, sexual activity, certain types of birth control, menopause, and genetic urinary tract abnormalities. I've noticed that hygiene is a big one, especially when it comes to the elderly population. So if you're incontinent of urine, usually wearing diapers, and not keeping yourself clean or unable to keep yourself clean, you're also a higher risk for developing a urinary tract infection. So how do we diagnose UTIs? Well, we'll need a urine sample. Basically, we're checking for bacteria in the urine, white blood cells, red blood cells, along with a few other parameters which can help narrow it down. A urine culture is also sent off, but typically takes a day or two to come back. So generally with the urine analysis, we can start treatment. So what is the treatment for UTIs? Well, if you're dealing with a simple UTI such as a common bladder infection, then a short course of antibiotics for 3 to 5 days should do the trick. If you're developing a more advanced infection such as a kidney infection, that might need to extend out to 7 to 10 days, and the antibiotics may need to be adjusted as well. A caveat here is if you have a kidney stone or another complication that is causing the UTI, then you might actually need a procedure such as a small surgery to fix the underlying cause. Still, antibiotics are given, but they are usually not enough. If you find that your urine infection is more advanced, going back to what we said earlier, you have fevers, chills, nausea, vomiting, or you're acting more confused, or you're having abnormal vital signs, it's likely that you're developing sepsis from a UTI. These are generally treated with IV antibiotics and hospitalization. So how can you prevent UTIs at home? Well, one is by staying hydrated and drinking plenty of fluids. This will flush out your kidneys and your urinary tract to help reduce the likelihood of bacteria multiplying there. Going back to what we said earlier, hygiene is very important. If you're a female, wiping from front to back is very important, as you're less likely to introduce bacteria from your GI tract. Avoiding any type of feminine products can also help, and urinating after intercourse can usually help as well. There are many more tips to prevent UTIs, but these are just some of the common ones. In summary, UTIs are quite common. They can affect various parts of your urinary tract. Ultimately, the treatment will depend on the location, the underlying cause, and the severity of the infection. Remember the symptoms of a UTI, and don't hesitate to call your doctor if you think you are developing one. If you found this video helpful, like and subscribe to help support the channel. I hope you learned something. Take care, and I'll see you next time.